Welcome back to Neurodegeneration Awareness and Artificial Intelligence. I'm your host, Dr. Sukant Khurana. We have previously explored neurodegeneration awareness in Gulf countries GCC. Today, we broaden our focus to wider non-GCC Muslim world, a diverse and geographically expansive area with its own unique cultural, social, and healthcare landscapes. To help us navigate this complex terrain, I'm honored to welcome back Dr. Kaneez Fatima. She is a neurodegeneration expert and also a pharmacology expert who aspires to work in a Muslim world. And she has done some incredible work in India and is planning to shift to Middle East. Welcome, Dr. Kaneez Fatima.
Thank you, Dr. Sukant. It's an important and often nuanced discussion.
Indeed, Dr. Fatima, when we speak of non-GCC Muslim world, we encompass a vast array of countries from North Africa to Southeast Asia. What are some common threads and key variations you observe regarding neurodegeneration awareness across these diverse regions?
You are right, Dr. Sukant. It's a broad spectrum. However, some common threads often include a strong emphasis on family and community support in caregiving, which I think can both be a strength and a challenge. There can also be a varying level of awareness about specific neurodegenerative conditions, often influenced by cultural interpretation of aging and illness. Also, stigma surrounding mental and cognitive health, while varying in intensity, can also be a significant barrier to open discussion and seeking professional help. Additionally, healthcare infrastructure and access to specialized care also present a wide range of scenario across these countries.
Yeah, that is true. So let's dive deeper into cultural aspects. How might Islamic teachings and cultural norms influence the perception and management of neurodegenerative diseases in these communities?
See, Islamic teaching emphasize compassion, care for elderly, and the importance of family bonds, which often translates into stronger family support for those with neurodegenerative conditions. However, cultural norms around privacy and the potential shame associated with cognitive decline can sometimes lead to families managing these issues privately, therefore delaying or avoiding seeking formal medical help. So, understanding these nuances is crucial for developing culturally sensitive awareness campaign and support systems.
Yeah, that is very, very true. So, healthcare infrastructure varies significantly across the Muslim world. What are some of the common challenges in providing adequate care for individuals with neurodegenerative conditions?
Many countries in this region face challenges such as limited number of neurologists and geriatrician, particularly outside major urban centers. Then access to specialized diagnostic facilities like advanced brain imaging and cognitive testing center are also limited. Additionally, public health system may be undersourced and with greater focus on communicable diseases or maternal and child health, potentially leaving chronic condition like neurodegeneration less prioritized. So all these factors lead to delayed diagnosis and limited access to ongoing management and support.
How does the level of economic development in different parts of non-GCC Muslim world impact neurodegeneration awareness and the resources available for care?
Economic factors plays a significant role, specifically in lower income countries. Awareness campaigns may struggle to reach widespread population due to limited resources for public health initiative. Then access to even basic medications and care can be a major financial burdens for family. As countries develop economically, there is often increased investment in healthcare infrastructure and greater access to information. Fortunately, which can lead to improved awareness and care, but I think disparities within countries can still persist.
Yeah. Are there specific cultural and religious beliefs that might influence how individuals and families cope with neurodegenerative diseases in these regions?
What I have observed is that faith often plays a substantial role in coping. Many individuals and families draw strength and solace from their religious beliefs, finding meaning and acceptance through their faith. This can be influenced, this can influence how they understand and respond to the challenges posed by neurodegenerative condition. So it's important for healthcare provider and awareness campaigns to be sensitive to these spiritual and religious perspective.
That is true. Given the diversity of this region, are there any examples of successful culturally tailored initiatives or approaches to raising neurodegeneration awareness that you have observed?
Yes, there are emerging examples like utilizing trusting community leaders and religious figures to disseminate information can be very effective in overcoming stigma and building trust. Along with that, integrating awareness messages into existing community health programs and adapting material to local languages and cultural contexts are also crucial. Then leveraging media platform popular within specific community, including television, radio, and social media, with culturally relevant narratives can also have a significant impact.
The role of technology, including AI, has been recurring theme in our discussions. How do you see AI potentially contributing to neurodegeneration awareness and care in non-GCC Muslim world, considering the existing challenges?
The AI offers several potential avenues. Let's say mobile health. So these mobile health platforms delivering information and support in local languages via basic mobile phone can reach underserved population. Then we have this AI powered chatbots could provide confidential and culturally sensitive answers to initial question about symptoms, potentially overcoming stigma associated with seeking in-person help. Also, AI could assist in analyzing linguistic patterns in local dialects to identify early indicator of cognitive decline. And for the region with limited specialists, AI-driven diagnostic support tools for a primary care physician could be invaluable.
That is very brilliant insight in terms of resources and the language part, right, and cultural nuances. So very insightful, Dr. Kaneez. Now, what are some of the ethical considerations that need to be carefully addressed when deploying AI in healthcare within these diverse cultural contexts?
Ethical considerations are paramount. Ensuring data privacy and security is crucial, especially in contexts where data protection regulation may vary. Then AI algorithm needs to be developed and validated using data that is representative of the diverse ethnic and linguistic group within the region to avoid bias. Cultural sensitivity in the design and delivery of AI intervention is essential to ensure that they are acceptable and effective. Finally, in addition to all this, transparency and explainability of AI tools are also very important for building trust among both healthcare provider and communities.
Yeah, that is definitely true. So, because you mentioned some interesting points, you are talking of data privacy, right? Validation, so cultural sensitivity, transparency, and explainability. These are all important benchmarks. So, I think very important considerations. Now, finally, what are the recommendations for researchers, policymakers, and international organizations looking to improve neurodegeneration awareness and care in non-GCC Muslim world?
Firstly, increase investment in research that focuses on specific epidemiological and cultural contexts of neurodegeneration in these regions is crucial. Secondly, there is a need of development of culturally tailored awareness campaigns in local languages involving community leaders and religious figures. Then, in addition, strengthening primary healthcare system and integrating basic neurodegeneration screening and referral pathway are also vital. Finally, we can say exploring the potential of accessible and culturally appropriate AI-driven solution while addressing the ethical consideration offers a promising avenue. And we cannot ignore international collaboration that facilitates knowledge sharing and capacity building as it's very important.
Yeah, that is very true. In fact, the way we want to address these things in both GCC and non-GCC Muslim countries is to bring in expertise from North America, bring in expertise from Europe, Australia, New Zealand, Japan, Korea, hopefully China. We currently don't have bridges there, and India. So I have bridges mostly in Western Hemisphere, where I was educated, in India, where I was born, and I'm currently located. So for us, the approach is obviously heavily reliant on international collaborations as well as domestic strength building. And wherever we don't have sort of enough issues of data which can be trusted, where people may have concern, deploying sort of federated learning models. So yeah, I fully agree with you on the last point that international collaborations are a key. So, Dr. Fatima, this has been incredibly insightful and nuanced discussion, shedding light on a vital but often less discussed area. Thank you so much for sharing your expertise with us today.
Thank you, Dr. Sukant. Thank you very much.
Okay, to put our listeners across, to all our listeners across the globe, thank you for joining Neurodegeneration Awareness and Artificial Intelligence. We hope today's discussion has broadened your understanding of the challenges and opportunities in raising neurodegeneration awareness within the diverse non-GCC Muslim world. Join us next time as we dive deeper into neurodegeneration awareness and AI in another region of the world. Until then, please subscribe, like, and share our podcast. Thank you. Bye bye.